Dear students, welcome back. In this session, we are going to discuss about front of thigh. This is one of the region in the lower limb. So now we are going to discuss about the front of the thigh. Now we will see the introduction for the front of the thigh. Normally, the front of the thigh extends between the hip and the knee joints. Okay, the superficial, and every region is having skin, and then superficial fascia, and then the deep fascia, and it'll have muscles, and also the related vessels and lymphatics and nerves we can see in the region, and also at the deepermost we can find the bone of that region. We have already finished the osteology of that bone which is present in the thigh, that is femur. Okay, yes, the superficial fascia contains one big vein that is called as great saphenous vein, besides the cutaneous nerves, vessels, lymphatics and lymph nodes. The upper third of the thigh medially contains, on the medial aspect, it contains one triangle called as femoral triangle, and middle third carries the femoral vessels through the adductor canal, and front of the thigh also contains four headed muscles called as quadriceps, besides the iliopsoas in the uppermost region, as well as the adductor muscles on the medial aspect. Normally femoral hernia occurs which is seen in the upper medial region of the front of the thigh. Okay, so these are the things now we are going to study in this region. So first we'll see the skin. Normally the skin of the thigh in the region around the pubic symphysis is studded with hair. So there we can find some hair, pubic hair. If you see, normally in a cadaver we can find some stitches found on that side, that is the medial side of the thigh. Okay, so what that stitches means, the stitches indicates the embalming for preservation of the body has been done from this site. So to preserve the cadaver, to preserve the body, they have given some 6 centimeters of vertical incision is given in the upper medial side of the thigh, upper medial side of the thigh. After reflecting skin, fascia and femoral sheath is incised, that means they have cut to visualize the femoral artery. Through this femoral artery they will pass some fluid that is called embalming fluid, which is prepared by mixing appropriate amounts of formalin, glycerin, water, red lead, common salt, and which is put in the embalming machine connected to a cannula. So they have pumped 8.5 liters of fluid through this femoral artery under 20 lb of pressure. So this fluid is going to help to preserve the cadaver. So this is one interesting and important thing which is related to preserving of the body. This is about the skin. Okay, now we will move on to the superficial fascia. So the superficial fascia is having two layers. So this superficial fascia is having two layers. One is superficial fatty layer and a deep membranous layer. Superficial fatty layer and deep membranous layer, which are continuous with the corresponding layers of the anterior abdominal wall. In the abdominal wall also we have seen the superficial fascia. In the superficial fascia it is having fatty layer and deep layer called as membranous layer. So those two layers which are also continuous with that of the lower limb. Okay, so that is into the front of the thigh. So the two layers are most distinct in the uppermost part of the thigh. So we can find these two layers separately in the uppermost part of the thigh. Okay. And near the groin where the cutaneous nerves, so here the groin, where the cutaneous nerves, vessels and lymph nodes lie between the two layers. In between these two layers we can find the lymph nodes. Here we can find the lymph nodes separately, and the cutaneous vessels, and also cutaneous nerves we can find here. Okay, and the membranous layer is loosely attached to the deep fascia of the thigh. So the next layer is the deep fascia. So to this deep fascia the membranous layer is loosely attached to the thigh except near the inguinal ligament. Near the inguinal ligament, and the remaining part, the membranous part of the superficial fascia is loosely attached to the next layer, that is deep fascia. Okay. So at the inguinal ligament it is firmly attached to a horizontal line. That line I have already discussed in the abdomen also, that is called as Holden's line. Normally it begins a little lateral to the pubic tubercle and it extends laterally about 8 centimeters. Normally pubic tubercle is there, so horizontally, and it extends laterally for about 8 centimeters. Okay. This line has one importance, that is when the urethra is injured in the perineum, urine may flow out into the interval deep to the membranous layer of the superficial layer. So this urine can pass up into the anterior abdominal wall, from where it can enter into the upper part of the thigh. So however, because of this firm attachment of this membranous layer of the superficial fascia to the deep fascia along the Holden's line, it prevents urine from descending into the thigh beyond the line. Okay, so now we will see what are the contents of the superficial fascia now. So in the superficial fascia, which contains cutaneous nerves, cutaneous arteries and the great saphenous vein. So what are the structures we can see in the superficial fascia? One is cutaneous nerves, and next one is cutaneous arteries, the great saphenous vein and its tributaries, and the superficial inguinal lymph nodes. Okay, now we will see the cutaneous nerves. So we have already discussed about this lumbar plexus, isn't it? Yes, and its branches. The skin of the front of the thigh is supplied by the cutaneous nerves derived directly or indirectly from the lumbar plexus. One is the ilio-inguinal nerve. Ilio-inguinal nerve, that is L1, which emerges at the superficial inguinal ring and supplies to the skin at the root of the penis and over the mons pubis in female, the anterior 1/3 of scrotum and labium majus and the superomedial part of the thigh. So superomedial part of the thigh is supplied by the ilio-inguinal nerve. Okay. Next one is the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve, and the nerve root is L1 and L2, which pierces the femoral sheath and the overlying deep fascia 2 centimeters below the mid-inguinal point and supply most of the skin over the femoral triangle. Normally the femoral triangle is present on the medial aspect, so up to here. Okay, so we are going to discuss this femoral triangle separately. Yes. And then next nerve is lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. This nerve root value is L2 and L3. So it is a branch of the lumbar plexus, and it emerges behind the lateral end of the inguinal ligament, and it divides into anterior. Okay, it divides into anterior and posterior branches and supplies the skin on the anterolateral side of the thigh on the anterior part of the gluteal region also. Okay, next one is the intermediate cutaneous nerve of thigh, which is also branch of L2 and L3. So this intermediate cutaneous nerve also supplies the front of the thigh extending from the sartorius to the knee. This one is sartorius to the knee. This one is sartorius line. Here the sartorius muscle is present, so which is supplying from sartorius to the knee. And coming to the medial cutaneous nerve of thigh, which one also L2 and L3. This one is the anterior branch of or anterior division of the femoral nerve, and this one is also supplies the skin on the medial side of the lower 2/3 of the thigh. So lower 2/3 of the thigh is supplied by the medial, lower 2/3 are supplied by the medial cutaneous nerve. Okay, these are all about the cutaneous supply of which is seen in the front of the thigh. You can mainly mention this femoral branch of genitofemoral nerve, lateral cutaneous, intermediate cutaneous and medial cutaneous nerve. Okay, and also ilio-inguinal nerve, which supplies on the superior medial aspect of the thigh. Okay, next. And next one is the Safanas nerve. Okay, the Safanas nerve, which is a branch of L3, L4, which is a posterior division of the femoral nerve. So which is going to supply on the skin medial side of the leg and foot up to the ball of the big toe. Okay, so here it doesn't have that much supply on the front of the thigh. Next one is so it may supply at the region over the ligamentum patellae. It may supply over the region of ligamentum patellae. That is the endest point of the front of the thigh. So we can consider here. Okay, and also the flexus of lateral cutaneous nerve, intermediate cutaneous nerve and medial cutaneous nerve, and the Safanas nerve, which are 5 nerves situated in front of the patella. So patella we can find here, in front of the patella and the upper end of the tibia. Okay, all these together called as patellar plexus. If you see the cutaneous artery, here we can't find the cutaneous artery in this pic, but the cutaneous arteries are superficial external pudendal artery and superficial epigastric artery and superficial circumflex iliac artery. These are the three small arteries arising from the femoral artery, which is seen just below the inguinal ligament. So what are those things? One is the superficial external pudendal artery. Okay, so this may run towards the medial side. Okay, so it supplies the external genitalia. Okay, here you can find the superficial external pudendal vein, which is associated with this artery, and then superficial epigastric artery, so which runs upwards like this, so which is associated with epigastric vein. And the other one is the superficial circumflex iliac artery, which pierces the fascia lateral to the saphenous opening, so here, and runs upwards below the inguinal ligament. So it will runs upwards below the inguinal ligament. Okay, and it is going to anastomose at the anterior superior iliac spine with deep circumflex iliac, superior gluteal and lateral circumflex femoral arteries. So these things we are going to study in detail about the arterial supply of the entire lower limb. Just you have to know that what are the cutaneous arteries. One is the superficial external pudendal artery, superficial epigastric artery, and superficial circumflex iliac artery. These are the three cutaneous arteries which are related to the front of the thigh. Next one is the veins. So we have finished the nerves, arteries. Now we can see the veins. So as we know that there is a largest and longest superficial vein which is present in the front of the lower limb. Here cephas means easily seen. Normally this vein starts from the foot, dorsum of the foot, from the medial end of the dorsal venous arch, which runs upwards in front of the medial malleolus, along the medial side of the leg and behind the knee. In the thigh, it inclines forward to reach the saphenous opening. Here we can find this opening called as saphenous opening. So this saphenous opening is the modification of the deep fascia. Okay, so where it pierces, so this vein is going to pierce the cribriform fascia, and here it receives three branches. At this stage, this saphenous vein is going to receive three tributaries. One is superficial external pudendal vein. So here we have seen, isn't it? So the same, and then superficial epigastric artery and the superficial circumflex iliac vein. All these three tributaries are going to end up in the saphenous vein. Okay, so this is about the saphenous vein and the superficial veins. Now we will move on to the superficial inguinal lymph nodes. So the superficial inguinal lymph nodes, normally it is arranged in T shape. These are arranged in T shape, and here we can see one vertical group, okay, lower vertical group, and an upper horizontal groups we can find. So the upper nodes are again divided into, so this is superficial inguinal lymph nodes is T shaped, and it is having one vertical group and that is lower vertical group and upper horizontal group, and this horizontal group is again divided into medial group and lateral groups. Okay, now the lower vertical group drains lymph from most of the lower limb, okay, and the upper lateral group drains lymph from infraumbilical part of the anterior abdominal wall as well as the gluteal region, and the upper medial group drains lymph from external genital organs, including the terminal ends of the urethra, anal canal and vagina. So these are the structures which we can see in the superficial fascia. Normally subcutaneous bursae is also present, that is prepatellar bursae we can find at the knee region, and also subcutaneous infrapatellar bursa also we can see along with the ligamentum patellae, and also two deep bursae called as suprapatellar bursa and deep infrapatellar bursa we can see. If you see the clinical anatomy, so normally we can see here that is bursitis, that is prepatellar bursitis, which is called as housemaid's knee, okay, and subcutaneous infrapatellar bursitis, clergyman's knee, okay. So normally why it is called housemaid's knee means, so for cleaning purpose many of the persons using their knees for that support, they will land their knees on the floor. So for that reason the bursa which is present there, that is prepatellar bursa, is going to inflame, so which causes the prepatellar bursitis. So this is all about the superficial fascia and skin and superficial fascia of the front of the thigh. In the next session we are going to discuss about deep fascia. Thank you.